Hello everyone, myself Dr. Rakshit, who is working as faculty in the Department of Pharmacy Practice. This is called the Pharmacy Mysore. I'll be discussing on today on the chronic renal failure. So you may be aware of it. So what exactly the chronic renal failure means that? In my today's class, I'll be mainly discussing on the different types of the renal failures. Okay, there is definitions part, and who are going to learn the concept of the chronic renal failure, they are going to understand about the different etiology factors, like what is the reason for the any persons to get the chronic renal failures. So what they are going to happen to them if they get the renal failures, the signs and symptoms, and also we need to understand about the different pathophysiology behind the each mechanism, how that exactly the renal failure has happened to the any kind of individuals. And I'll be mainly targeting to the students who are pursuing their B Farm or the doctor in pharmacy or in the master in pharmacy part. By the definitions, that chronic renal failure is nothing but, so whenever the person has any chronic renal failure, he may have anemia, okay, reduction in the blood levels, then acidosis is mean to say the H plus ions, okay, it may be reduced, and osteodystrophy, the patient may have reduction in the bone size part, and they may have the neuropathy, so they may have the tingling sensation, numbness in the hands and feet, and also they could not able to do the movements. Okay, whenever they do the movements, usually they feel like the fluid has been accumulated in it, especially in the hands, legs, or in the face. Okay, so why this has happened is because of the kidneys not able to function properly. So before going to this definition, we should understand what are the different functions of the kidney. Okay. The next is that. So by the, another definitions, this is called that as progressive deteriorations in the renal functions that leads to the structural damage to the existing nephrons. So whenever the person has any damage, just like the nephrons are going to get damaged, so obviously the functions of the renal system is going to get reduced. Further, they may be developed with this acidosis or osteodystrophy or the neuropathy or the edema. These are the things is going to happen to the patients who has chronic kidney diseases. So now I'll go and come to the different stages of CKD, how we are going to classify this based upon the glomerular filtration rate. So how much is the filtration the kidney is going to do it? So based upon that, we are going to classify it. So if the GFR is between more than 90 ml per minute, we call it as the damages has occurred to the kidney, but the glomerular filtration rate, that is glomerulus, is a part, is the organ in the kidney one, so where the filtration is usually happens. Okay, then we call it as stage 1, and if the stage 2 is between 60 to 89, that means the GFR is between 60 to 89 ml per minute, the kidney damage is going to occur, but slight reduction in the GFR, the filtration may be is reduced. Whereas if you come to the stage 3, it's called as moderate reduction in the GFR, where the filtration rate is between 30 to 59 ml per minute. And whereas in the severe reduction in the GFR is between 50 to 29, will be the stage 4. And in the stage 5, you call it as end-stage renal disease, or the patient who came with the renal disease, he himself should undergo dialysis. Okay, that means that the doctors are going to recommend the dialysis one. That's we call it as stage 5, or we can tell that as end-stage renal disease part. Okay, these are the different classifications of the chronic kidney disease part. So now we are going to discuss on the what are the causes of CKD. So mainly what is the reason for any individuals to develop any kind of kidney injuries, especially the chronic part. One is that diabetes mellitus. Right now, the diabetes is very common in our in Indian settings, right? So the person who has diabetes and is not able to control his glucose level in the adequate like normally part. So always the glucose levels will be keep on elevating. That's the main reason. Then the second part is that the hypertension. This is also the second leading of chronic diseases in India right now. So every Indian individuals will have the increase in the blood pressures. So blood pressure may directly damages to the kidney. And the third part is that glomerulonephritis is a kind of infections which is going to see in the glomerulus. So any kind of bacterial infections may cause for the nephron to get swollen and there is no filtration is going to happen to the patients. Then the next is that interstitial nephritis. So if you take the kidney, you have three parts. There is pre-renal, intrarenal, and the extrarenal part. So within the inside the kidneys, so there are almost 2 to 3 bacteria are going to stay there. Then they develop and then they cause the what do you call that as infections may lead to the damage to the kidneys. And the next part is that cystic kidney disease. That means the cyst kind of things, especially the sum of hard mass has been developed in the kidney. That's we call it as the cystic kidney disease and the myelomas. So the plasma cells are going to get the cancer part. So that's we call as the multiple myeloma. Okay, and also some of the chronic pyelonephritis also may be the reasons. This also the chronic infections may be there. You can see in the patients. Then the congenital abnormalities by birth, the patient may have the chronic kidney diseases, and because of the any kind of metabolic diseases like the diabetes or even impaired metabolisms like the hypothyroidisms. So that may end up with the chronic kidney diseases if they are not taking in the proper care as well as the treatment is not able to given properly. And the last part is that the urinary obstructions. So urinary obstruction in the sense the urine can't able to move from the bladder part. So there is a kind of obstructions whenever we passing our urine one. Either is a blockages part or there's a formation of stones or the compressing of the urinary tract the track one. So like this. So these are the different reasons for the chronic kidney disease. Next is that what are the signs symptoms may occur. If you take the central nervous system, the blood part, so the brain one, sorry. So the patients who has CKD may have the confusion. Totally, they are going to be confused. Then they may have the fits in it, the seizures kind of things. And finally, they may go with the coma part. And for the blood, if you take, so the patient will have decrease in the hemoglobin, that's anemia, and also the platelet counts are totally less. So they may lead to the bleeding part and the patient may die. And if it comes to the renal specific one, so they'll have the frequent urination that we call it as a polyuria. Then is at the nocturia, night time, the patient may feel to urinate, and also the sodium and water are keep on retaining in the body, so that the patient may develops the fluid accumulations in any part of the body, especially the face, okay, the upper and the lower limbs part. Comes to the hormone, so usually the person who has CKD, okay, they may have the infertilities. So the sexual characteristics are a little bit less. Desires are less to this person because of the abnormal hormonal secretions and amenorrhea. Okay, so history of skipping their periods. Okay, and also some kind of the bleeding part, the spotting on them, and then the patient may have the impotence. So they may try to have the sexual contact, but still they could not able to feel it. So like this, the hormonal symptom changes are going to happen. And also for the bones, the patient may have pain. Then the bone is going to get less density and is going to get develop the osteosporosis part. And also because of this, the patient may have the thyroid one called as hyperparathyroidism. These are different symptoms that's going to happen because of the kidney. Heart, since I told hypertension is a main reason, so acute exacerbation of hypertensions and heart failure are going to get seen. Because of the hypertension, the patient may develop the CKD, and also the heart failure is going to occur to the patients, and also infection in the pericardial regions within the heart, and also the vascular disease, some blockages in the blood vessels, and also to the edema one, so fluid accumulations. And if it comes to the GI tract, the patient will have vomit, like feeling like to vomit, and vomiting is the main things. So this is all because of the nitrogenous waste that the kidney to be excreted. It won't excrete, it's keep on accumulating, especially in the GI tract. The patient may develop the nausea as well as the vomiting. And also the patient may have the peripheral neuropathies that involve the tingling sensations, especially in the hands as well as the feet part. The last part I'm going to discuss you is that the pathophysiology, how this pathophysiology of chronic disease is going to occur. As you have read about the symptoms, then the different causes, now I'm going to explain you how it is going to happen. So whenever the chronic kidney diseases, the function is going to get reduced, the first part is that sodium and water keep on retaining. So whenever the sodium water keep on retaining, the more, as you know, the more amount of sodium is present in that is increase the blood pressure. That's may usually call that as hypertensions. So that because of this, there's a mechanism we call it as aldosterone antagonist, like that is going to get activated. So the volume is going to get increased. That is because of the more fluid accumulations. So that more fluid accumulations will leads to the heart is going to get failed off. That is a one. And the second part is that since the kidney has a function of eliminating all the heterogeneous waste, then the urine one, the production of hemoglobin, all this part that was the function it was doing. So the electrolytes are going to get imbalanced. Okay, so there is a more amount of potassium stays in the body. So potassium states in the sense increase the heart rate. So that may leads to the hyperkalemias. Second, the next part is that it can't able to eliminate the nitrogenous waste. So blood urea nitrogen is keep on accumulating in the blood. Okay, and also we call it as the uremia part is going to occur. And the main production of erythropoietin synthesis is going to occur in the kidney. Since the kidney is damaged, so there is no erythropoietin productions, the patient may develop anemia. So that's may leads to the further uremia is going to get increase, has been seen more, leads to the coagulation pathy. We call it as decrease. The patient may have the less amount of coagulations, okay, or even the platelet levels are going to be keep on reducing. That's may leads to the bleeding. So the patient may die because of the more bleeding part. And the acid-base balance, H plus ion, bicarbonate ions, all this part will be keep on means that it's keep on reducing. So the patient may have the acidosis part. Then if it comes to the vitamin D level, so the D level will be keep on reducing. Okay, so the more amount of vitamin D is excreted, and the vitamin D will be less in the body. So leads to the calcium decrease in the levels of calcium. Okay, so because of decrease in the level of calcium, the phosphate elimination also will be reduced. Okay, so because of this vitamin D, calcium, and phosphate, so this is the secondary. They may develop the hyperparathyroidism. Okay, disorder in the thyroid glands. From that leads to the osteodystrophies, that the bone is going to get fractured. This is a kind of osteosporosis kind of things. Okay, so these are the different pathophysiologies is going to occur because of the chronic kidney disease. So if you have any doubts, you can ask me. Okay, and this is the small topic regarding your subject. Thank you.